As first in total, but I will more in expensive or frequencies, apodosis, that apodosis also, but that will be covered after before studying everything, I just in my small introduction, myself covered from the family. I did my MD Pharmacology, 2018 from ITC, and then did my fellowship in Pharmacology. So, anyway, for introduction, but I think when I was like initial, Pharmacology is such a vast topic. And everything, I think, every topic was like putting up the what and for my purpose, like I will try to cover the topic as possible, and I will ask everyone to initially go through all these things from my classroom, you can take a classroom from my topic and just stand and read and try to understand what they are trying to teach. Because undergraduate is not possible for everyone to understand everything. But I just want to everyone to make a concept of each and every topic which are to be covered. But before that, everyone want to say that is there anyone who can understand this? Yes. This is my photo that I think when you are trying to conceptualize anything, you should conceptualize it in your mind. আমি বাংলা ইংলিশে পাস করেছি এবং আমি যখন আন্ডারগ্রাজুয়েট ছিলাম আমি যা কিছু করেছি আমি ট্রাই করেছি আবার ভাষাতে so obviously when you will write exam it should be obvious official language but when you are trying to conceptualize please write it this is my idea. John when anyone trying to not trying here, supposed to find that. I think some of you can lab or something like that. But that part, when you are trying to go outside, like you have to learn there. So this is my example. When you are trying to make concept of the topic, right? Anyway, let's start. Students at this stage, from your first year experience, a cell in our body, every time is facing so many hazards related to oxygen. Or this oxygen mental injury cell. What is that kind of injury? What is that? Basically, this is an imbalance between internal and external environment of the cell. There is an internal environment which is known as homeostasis. Each and every one can come across this particular term homeostasis. Homeostasis হয় না যদি এই homeostasis balance, that is the balance between the internal and external form of a particular cell is lost, there might be some changes within that cell. That series of morphological changes, while you thought within the cells, is known as সবাই একটা জিজ্ঞেস করব কোন স্ট্যান্ডার্ড টেক্সটে থেকে আমাদের ডেফিনিশনটা ইন টোটো মনে রাখা আছে you should point out the key elements key points of that particular definition and you have to demonstrate each and every point of that. So what is the definition of series? Series is defined as a variety of spaces in formulas as a result of changes in internal and external environment. So say at a change external environment that will be trying to adopt that change in the external environment. Shape adaptation always এরকম দু হয় যে সেটা নরমালি সেলের জন্য রেডিয়েশন হতে পারে অনেক সময় and most of the cases সেই রেডিয়েশন হতে ভালো but what are the two factors which causing that outcome of that injury this the type of failing body and the extent of that Cannot injuries. The internal process. Initially, we try to divide that process into two parts: genetic part and backward part. In the genetic part, initially, the most important process are the defect in the morphology. Normal morphology যে আমাদের এমব্রায়োজেনেসিস ফলো করছে না আমাদের এমব্রায়ো থেকে একটা ফুল অ্যাডাল্টে গ্রোইং আপ হচ্ছে তখন যে প্রসিডিউর গুলো নরমাল প্রসিডিউর গুলো হচ্ছে সেখানে যদি কোনো এরর second if there is a chromosomal adaptation okay chromosomal adaptation means anything if there is any change in the pairing of genetic mutation, if there is a deletion, if there is a addition, any kind of you will come up with that is the next class after 1-2 classes genetics part. So I am not going there also. Any also any change in the normal genetic loci can change the external that is a change of external so that is an obvious result of variation. So single gene defect is a cause of variation. Obviously there are inheritance any genetic inheritance and there are other causes of inheritance also that might cause in actual cause of most important cause is lack of blood supply that is known as hypoxia that is known as dyspnea and this dyspnea that blood supply is causing lack of oxygen the same is deprivation of oxygen that state is known as hypoxia so this hypoxia deprivation of cell of oxygen is known as hypoxia deprivation of cell of blood supply is known as dyspnea so these two conditions is working environment and this is the most important cause of cell other obvious causes of cell injuries are physical results like changing temperature radiation change in pressure can cause the injury. Chemical and well-developed drugs like urea, polycarbonate, plastic, the obvious that microbiology in the microbiology part there are so many different bacteria, viruses, fungi, any parasite they can cause injury. immunology. Anything external, anything or antigen, when it comes within the body, that loss. Any nutritional derangement, malnutrition, can cause aging. Aging is a process. It's a physiological process. Obviously, that the aging process is caused obvious. Any psychological stress, any surgical cause that is known as iatrogeny, and immunotherapy, we don't know when and why. So, what I have to cover is that when external environment changes, the same part of adaptation. That is called as cellular adaptation. I think in the previous class we got some idea of that cellular adaptation. See? Stop. Okay. So, in the adaptation class, Dr. Hussain is trying to move on that there might be some changes that might be beneficial or harmful. That's it. If that particular obnoxious stimulus is again continuing in a transient phase, this is what the stimulus is threshold then in that case, that cell goes into phase of reversible. The morphological effect which is going on within that cell is reversible process. Cell can depart back from that morphological feature. This is what is reversible. But when the is inhaled and this injury is persisting for a long time, that will cause a cell death. It is known as irreversible cell. And basically, this is the topic. It is my topic. So, it might be of two types: necrosis and apoptosis. So, what are cellular adaptations? So, although after the stimulus action, that will be prolonged, that might be transient. Cellular changes begin to occur. After adaptation, now yes, example endometrial hyperplasia, exactly endometrial hyperplasia in the box. I have cell size percent, number percent. How each image died, how long, biceps, যখন আমরা স্ট্যাটিক এক্সারসাইজ করছি তখন স্কেলেটাল মাসল অ্যানাটমি হচ্ছে দ্যাট ইজ আ পারফেক্ট এক্সারসাইজ অ্যাটমি যখন সেল ল আছে বলা হয় metabolism. This is the term when you are reading pathology, and pathology. This is your metabolism. যখনই তুমি কোনো ক্যান্সারে যাবে ক্যান্সারে যখন ক্যান্সারাস চেঞ্জ স্টার্ট হবে that cancerous change start from that metabolism. When a differentiated cell is changed into another differentiated cell is known as metabolism. একটা খুব ভালো এক্সাম্পল তোমরা অনেক পড়বে না পড়ো not only esophagus likewise characterized for epithelial cell when that is changed to a column that is intestinal line is top of epithelium or any goblet cell is known as parent esophagus cell But when this metabolism due to this metaplasia, that changes is irreversible, and this is unorganized. This unorganized cellular development is so this photomicrogram which is showing any cells can have adaptation, but when that injury is obnoxious, but in mind and conscious, the cell going to face up reversible cell injury, but when that obnoxious injury for a persisting but not period and severe, the cell may do reversible damage that might necrosis might be happening. That's it. But why is and how these cellular injuries are occurred? That is what is the obviously this is a tough one. Just trying to conceptualize what is going on in the cell. When there is an obnoxious evolution. Suppose hypoxia is occurring. This is the site where any change in the cell first takes. It is the site for degeneration. So, any hypoxia is causing decrease in degeneration. So, this is decrease in degeneration. That leads to three things. One, sodium, potassium, not working. Means what you mean by the not working, not causing any change in the sodium potassium mix. The sodium normally mass concentration so that outside, potassium inside. So that potassium should be inside, but any part of the potassium. Normally sodium outside that sodium is very concentration in the cell. That is defined water. Cell increase in size. That is called the swelling. That will be called a plate. Okay. So these that means the pH of the cell will decrease and lactic acid within the cell increase. Increase in anaerobic glycolysis. That is causing increase in pH. And this due to decrease in activity are actually like ribosome separated from endoplasmic reticulum. That is decrease in protein production, decrease in protein production. Mitochondria changes your age. They due to damage in mitochondria, what are the important function of mitochondria is to removal of reactive oxygen species known as free radical. Obviously, we can talk that variations in the latter part of our lecture, but that pre-critical injury is oxidative, known as oxidative stress is causing cell damage. So, that micromolecule damage is causing increase in reactive oxygen species, which are oxidative stress. Any questions? Sorry. Fine. Next, next country, microbial body next country. Okay. Imbalance in calcium. Normally, calcium is not contributed to the cell, but when there is cellular injury, the selective conductivity of membrane is lost. So, the calcium can easily enter within the cell. That will lead to activation of so many agents. So, imbalance calcium metabolism means more calcium increase in the cell, causing activation of enzymes in downstream. These enzymes are causing damage to cellular membrane, to mitochondrial membrane, to nucleus, to everywhere, to lysosome film. What are the changes in the lysosome? Increased production of free reactive oxygen species, reactive oxygen. What is the changes in the nucleus? Segregation of DNA, that is protein, and we need cell membrane that will cause the defect in the selective pathway of cell membrane. And the last point is accumulation of degraded as misfolded proteins. These are damaged proteins, these are misfolded proteins. They are mechanism. You can consider any mechanism of mitochondria increasing the ATP and increasing the reactive oxygen species. This reactive oxygen is causing damage to the living protein DNA. Any of the calcium in the cell causing the activation of so many enzymes in downstream. And defect in the selective constituents of cell membrane. So, cell membrane defect contributes to many things. And within the cell, whatever should be there within the cell, they can go out outside the cell. Okay? And both there will be protein misfolding, which is causing increasing protein factor. Misfolded protein causing increasing or activation of pro-protein factor. A problem I can elaborate and tell you what is the pro-protein factor. So, what is necrosis? Necrosis is localized death of cells or group of cells or tissue due to any external obnoxious stimuli causing degradation of that particular tissue and liberation of that cell causing inflammation. He also cellular permeability loss and activation of enzyme zero Injected to cell damage and cellular continuity loss regulation, nothing isolation. External to the cell, they are going outside. Okay, and there is obviously there is loss of DNA, protein, everything. So ultimately cell is damaged, and their cellular outline is lost. This is digested by those kind of features developed outside the cell, and this cellular debris are toxic, nothing but damaged. That is the involvement of that particular chemicals and liquids. So it is this synergy that is damaged proteins and everything are going outside the cell, and they are causing inflammatory reaction. Anything which is recruiting neutrophils, macrophages, any inflammatory response always should be remembered that it is due to enzyme. Cell division to other parts, pathogenic process. So, otherwise, this is pathological, and this is associated with the inflammatory damage. For particles and reducers will operate, and they are involved by neutrophils and other cytosol, and they are trying to clear the debris. So it will cause that there is no problem. But what you can see that apoptosis is not causing any confusion because there is no as such damage of organized base. This is the main morphological difference between necrosis and apoptosis. How can we recognize the cell is damaged, or what are the morphological changes? So we are trying to see anything, we are examining any tissue under the microscope in histology section, we state that tissue hematoxylin. This hematoxylin is basic in nature. They state nucleus glucose and Q is always acidic in nature. They state cytoplasm. So this is hence there is lot of nucleus. That means this blue portion is average increasing amount of factors. So this big portion is this is called as increasing. This practice. What are the nuclear changes? Genetic nucleus are they are again integrated. They are making some important changes. You can see that. What are the changes? Catalysis and mitosis and catalysis. Catalysis means dissolution of nucleus. The protein damage is seen in catalysis. When this nuclear material is produced within a cell nucleus, within a cell, it is known the shrinkage of that nuclear material is known as mitosis. And when this protein is fragmented, this is known as catalysis. This is very important but fancy term. There is no particular arrangement of that particular damaged cell, and which is coming first, which is coming second. There is no such serial. The serial is not maintained anywhere. But this nuclear changes in the term, you can examine nucleus in damaged nucleus. Next, this plasma membrane, which is damaged by protein, they will accumulate within the cell. This is known as myelin tissues. It's not only part of the membrane of microorganisms also. Initially, in the previous ages, we usually in your ages, the second year, was quite like this, known as something out of this in microorganisms. This is same thing in obviously in the life form because this mitochondria is happening within the life because these changes are initially of by the system. So this abundant cardiac figures that is present in the life. That is seen only in the. So what are the patterns of excretion? The most common pattern is coagulating necrosis, other than coagulating, lipid ischias, ganglia, fat necrosis, and tissue. The most common mode of injury is hypoxia. And where is the tissue is coming from hypoxia? It is what means in the cellular outline, you can see that it is a photometric of the under microscope. You can see this arrangement. This is nucleus and these are cubiculus. But and the nucleus is diagram, low column that should have nucleus within the cell. But this nucleus is all. These are gametes, nucleus. This is an example of active nucleus. But this how of that cell is look like not so. This is the key feature of body. When the body is the damage cell maintain its regular outline. Any changes which are common in necrosis, obviously that will be found out in the population also. This is more in each and every organ except why? Because when there is any high amount of genetic activity, that damage membrane will be digested by the so the organ is not intact. So the pattern of the necrosis is associated. That pattern is associated. So what is that? Any polymeria which is under any walking disease means that the cause that is diabetes. These are two kinds of wildlife. What action is when a organ having a baby attack and there is operation of that any element. So that particular part of that organ which is supplied from the blood is having an option. So this area is why but when there is dual or so many venous occlusions or if it is loose like liver that like hemorrhage rate. So I normal tissue, dead tissue, and increase that there will be presence of neutrophils. These neutrophils will engulf the damaged cells and debris outside the normal. There should be a clear demarcation area between normal and brackets half. Evolutionary bracket, yes. If it has a pattern affecting it, there should be increase in negative that happens. Thus, O and that are ultimately cause a liquefied state. This liquefied medium should be engulfed by neutrophils so that they leukocytes, liquefied bases mix up with each other and form a bag of parts. That part where the protein is mixed up with neutrophils coming from outside. They are causing something like a bag of parts. It is a culture. Which is already there. See, there is no clear cut demarcation and normal. Easiest when we are we must have depth knowledge about the work. Any invention we have to develop initially. And when there is the most important different conditions development. And at the center of that, there is this cheese there. Asians mean cheese. The not from cheese. So we need a term. What is that? The damaged cells of cheese-like material is surrounded by epithelioid area-lying cell. This is known as epithelioid cell. These epithelioid cells are accompanied by lymphocyte classes. And there is change in epithelioid cells. So many epithelioid cells are coming together and there is basic morphological change. Multinucleated giant cells. In case of human blood and heart, there is gland and juice. So, in most of the center, there is juicy necrosis happens. This is an all you are the next part can be basically treated by gas. But this is not economic. It's just a single way of particular part, like right, which is operating the distal part of the veins or increase in your blood supply, is basically a kind of problem. And which can be found in not in most of the weight orders like small intestine or if any bacterium is associated with superactive bacterial infection is known as weight. It is basically it is nothing but a simple law. Initially, there should be a cooperative one. The battle is coming. They recognize some insects. They are causing the language of some particular state issue. So, in this kind of bacterial access, then there is possibly and that is called insect molecular range, particular microbial. Same So, this is a type of populated process. Where can you make this type of next this is a new stuff. After I am covering my mouth. You can find some please try to anyway, factors is next factor. We can stop by what that factor is what fact itself is named names in order where that is if there is failure of that particular organ, pancreatic cells, liver, when there is this amount of they pump up right side. Big acid factor has been found by calcium. Chopping white last item is remind this great strong. Meaning is a identification. In what usually pink. This pinkish material within the site why are we hypothesis reaction at during last reaction first there are four types in type 2 and type 3 when there is accumulation of antigen antibody complexes tuning of media inside blood vessels, medium-sized blood vessels. This accumulation looks like pinkish fibrin-like cells within the blood vessel. These are all characteristics, not characteristics. We go by managing that hypertension, obviously, but this is not immunology. Stress, pressure. So, these are completely different type of cell. It is an organized one. It is organized from nucleus sockets. And there will not be any immunological reaction or inflammatory reaction associated with apoptosis. What are the differences? Inside necrosis occurs pathological, but when the cell is suiciding, it is physiological or quite abnormal. Like any virus infected cell, it is pathological. But the main difference from pathological necrosis is always defined on the input. See? Any type of information. So, if there is the information that is to solve the next. Having said that, I obviously try to figure it out that why that necrosis cells are swelled up But here the cell is not further. This is program one. The nucleus is damaged and the whole thing is increasing in size. The cell is increasing. So that is and what is context? Well, our integrity of integrity of the law. So, usually, a tissue is a group of there is a lot of myself. There are two approaches, but there are in physical life, if the organ is normal or level or pollution in a group of the cell or host cell, like the development of T. You should be aware of all this point, but that will be not enough other processes in other forms, like the time of genetics. Pathological process like as I showed earlier, pathological and copy is called pathological copy. And you must like C there is a this is nothing but being on the lines. And also, in my versus it was but obviously when it goes up so, after this other type of hormone, it has three parts: initiation phase, execution phase. The whole process is controlled by a single name of enzyme, the group of capsules. So this initiation phase and execution phase both are executed by capsules in the presentation as a point. But when they are activated, they constitute the same. If we are so initiation phase there initiator usually three times and execution phase three, 6, 7. Yeah. So patterns when the cell is applying season, which pushing the cell from position and those patterns which are preventing that switch. So in all cells, there should be and the automatic factor is the cell is going to be that is important. You should be able to the rate function if there is increasing if there is active protein, there will be safety high. Basic. So, basic says during the initiation, signal coming from nucleus This signal causing binding of fats is highlighted. This causing polymerization of fats. Polymerization of fats. Polymerization of fats. Fat will mitochondria inside of again mitochondria just fight in just fight in. Can I ask something? Very fast fast. This is called fast. Fast is basically in outer mitochondria. We what kind of fat? The fat associated dairy. This activation of cascade activated cascade stage ultimately becomes activation of multiple each case of extended in case of expensive pathway, all these activated causing activation of multiple cascades. What is activation? Same level of antioxidant factor, decreasing level of protein factor, increasing. These changes causing loss of selective possibility again or loss of selective possibility of mitochondria. So there will be leakage of cytochrome C from mitochondria, which is basically the inner mitochondrial membrane. Okay. This cytochrome C binds with the apoptosis activating factor 1. This is an apoptosis activating factor which is working in the ATC pathway. This binds with the cytochrome C. The whole thing ultimately activates the caspase 9, and this caspase 9 comes in the execution phase. Caspase 8 extensive and caspase 9 increasing pathway, causing activation of caspase 3 and 6. This caspase 3 and 6 is executive pathway, causing ultimate damage to cytoplasmic and brings and we can condition the syndrome. The whole thing is execution of so say damage, that is shrinkage of cell, condensation of nuclear property, and damaging of membrane.
Am I audible? Classmates? Audible? Today we will discuss about metabolism. Metabolism is a part of pharmacokinetics. So, pharmacokinetics. What is pharmacokinetics? Anyone? Last one. Please stand up. What is pharmacokinetics? Please. Do you know what is pharmacokinetics? Anyone? Raise your hand. What is pharmacokinetics? Next one is what are the part of the pharmacokinetics? What are the different stages of pharmacokinetics? Absorption, distribution, excretion. Very good. already covered. So we will discuss about metabolism. Another thing is biotransformation. So a drug taken, absorbed, distributed. After distribution, it goes into the systemic circulation. After systemic circulation, it goes into the target organ. And it acts, it does its pharmacological action. After that, what happens to the drug? If it is built up, then what happens? Toxicity. So it has to be eliminated or excreted. So metabolism is the part which makes this drug easier to eliminate. So it is absorbed, distributed, then goes into the target organ, target molecule activated, does its pharmacological action. After that, it got metabolized so that easily eliminated or excreted. So what is metabolism? Metabolism is a chemical reaction. It is a chemical reaction where the drug which is more lipid soluble became more water soluble, so that it is easier to eliminate. Clear? So it is a chemical reaction make the drug more water soluble, so it is helpful to excrete it. Clear? So where it is happened? Which organ? Primary liver. Other than that, kidney, lung, even in plasma, there are some enzymes that can metabolize the drug. So site of action is primary liver. Next, kidney, lung, and plasma. There are enzymes that can metabolize drug, but primarily liver. Very good. And which part of the liver? Endoplasmic reticulum. Most of these enzymes that helps in metabolism present in the endoplasmic reticulum. Endoplasmic reticulum মনে আছে? মনে আছে বলো তো? And when the another name of this endoplasmic reticulum is microsoma. Microsomal enzyme. Microsomal means this is endoplasmic reticulum. After centimeter is not microsome. And all these enzymes is present in the liver, primarily in the endoplasmic reticulum. Clear? Hello, what is metabolism? What are the site? Site means first organ wise, liver, then kidney, lung, plasma. In the liver, it is what is the microsomal enzyme? Microsomal means is endoplasmic reticulum. The enzymes primarily present in the endoplasmic reticulum. Clear? Site. Next one is that what happened after metabolism? Primarily, if there is an active drug, it became inactive, most likely. But there are some evidence that active drug produce active metabolites, like morphine. There are examples that inactive drug like levodopa. You heard of levodopa? So, L-dopa is an inactive drug. Used in Parkinsonism. The disease of Parkinsonism, what is the target organ? Inside the CNS. Basal ganglia, very good. So, what is the basic pathophysiology? There is a decrease or imbalance of acetylcholine with dopamine. So, it is required to increase dopamine inside the CNS or basal ganglia. So, L-dopa when given in the systemic circulation, if it is metabolized and produce dopamine peripherally, they produce more toxicity or side effect but less pharmacological action. So, to became more effective carbidopa, which is an enzyme inhibitor. They inhibit that enzyme peripherally, so that levodopa goes inside the brain, and inside the brain they became dopamine. So levodopa is an inactive drug, but after metabolism became dopamine, which is an active component. So metabolism can primarily active drug, phase 1 and phase 2. Phase 1, as the name suggests, is mostly the first action, and phase 2 is the second action. But there are examples where directly drug metabolized to the phase 2. So there are another name, there is a synthetic or conjugation reaction for phase 2. So non-synthetic or functional reaction is the name of phase 1. Okay? Phase 1, phase 2. What are the target? Our target chemical reaction target ka ki chilo? Make the drug more water soluble and less reabsorbed in the kidney so that easily excreted. So first one is phase 1. Phase 1, there are 5 ones: oxidation, reduction, synthesis, cyclization, decyclization. 5, and you have to remember this 5. Now oxidation, reduction মনে রাখার কোনো অসুবিধা নেই, তাই বাকি তিনটে যেন মনে থাকে: cyclization, decyclization, and hydrolysis. And if able to remember some examples, most commonly atypical ones. So atypical ones are cyclization. Proguanil is an anti-malarial drug. They got cyclization. Decyclization primarily happens with the barbiturate and phenytoin. Barbiturate and phenytoin is the anti-epileptic drug. Proguanil is the anti-malarial drug. It is not required to remember, but if you remember it is anti-malarial, then you are easily can correlate with that. So cyclization, proguanil, decyclization is phenytoin and barbiturate. Clear? Iki tale last mein black star. Na jacket. Aate to paase. What are the different types of phase 1 reaction? Typically, oxidation, reduction, hydrolysis, cyclization, decyclization. The example of cyclization is proguanil, metabolism of proguanil, whereas barbiturate or phenytoin, which are the anti-epileptic drugs, are the example of decyclization. So this is the phase 1. Next, phase 2. Phase 2, there are 7 ones, and you have to remember at least the name. So 3G, glucuronide, glutamine, lysine, and then you have to remember 3 of these things. After that, acetylation, methylation, sulfate, and nitronucleic acid. So what is the effect? These are the group that bind with the phase 1 metabolites or directly with the drug. So what is the effect of this? What is the effect of phase 1? What is the difference between phase 1 and phase 2? Phase 1, there is a oxidation or reduction, make it more polar. Then what is phase 2 does? Phase 2 binds something with the phase 1 metabolite or directly to the drug. What happens? Then molecular weight will be high. The drug or active metabolite molecular weight will be high. It will less able to reabsorb from the renal tissue. Molecular weight যদি বেড়ে যায়, এক হচ্ছে ফার্স্ট ফেজের টার্গেট হচ্ছে মোর পোলার, সেকেন্ড ওয়ান মোর মলিকুলার ওয়েট। ক্লিয়ার? সালফেট, গ্লাইসিন, গ্লুটাথায়োন, রাইবোনিউক্লিক অ্যাসিড। তাহলে তিনটে কি হলো? গ্লুটাথায়ন, লুপিনোলাইট, গ্লাইসিন। তিনটে কি হলো? আবার অ্যাসিটাইলেশন, মিথাইলেশন, সালফেশন এন্ড রাইবোনিউক্লিয়েটাইজেশন। এগুলো কনজুগেশন। With the help of some enzyme, they bind with the fast phase metabolite or directly to the drug to make it more molecular weight. ঠিক আছে? তো unable to reabsorb. phase 1 phase 2 এলে এবার কি না দিতে হবে তো ওদিকে 5টা থেকে 7টা নাম দিতে হবে তো তাহলে 60% দেবে। phase 1 phase 2 phase 1 এর একটা কি করে phase 1 more polar, phase 2 molecular weight will be high. So example of this and which are the enzymes? Glutathione is transferase is the enzyme for glutathione conjugation. Glutathione conjugation is important for paracetamol poisoning. So paracetamol metabolized with this glutathione conjugation. Then phenolic compound they primarily acts the sulfate conjugation. Glycine, salicylic acid. Salicylic acid means aspirin. Salicylic acid they bind with this glycine. And it is the minor pathway. It is not the major pathway for the glycine. For the salicylic acid. Clear? Then acetylation. For acetylation, acetyl-CoA enzyme. This enzyme is important for acetylation. Then methylation, methyl transferase. Methyl transferase is the important for the conjugation reaction of methylation. And UDP, glucuronide transferase, is the enzyme for glucuronide conjugation. ঠিক আছে? প্রথমে নামগুলো মনে রাখতে হবে, সেকেন্ড হবে at least এনজাইম গুলো যেটা মনে থাকবে। ঠিক আছে? এইটুকুই হবে তো নিজে নিজে। So drug may go to the first phase, become metabolite and directly excreted. Some of the drug directly excreted without any metabolism. Lithium. Lithium is directly excreted. Lithium is the drug which directly excreted. Here, most of the drugs go to the first phase, they metabolite can go directly excreted or go into the phase 2, they are excreted or go directly to the phase 2 and excreted. So all possibility can be there. Most common is the phase 1 followed by phase 2, then excretion. Clear? Examples of a drug which directly excreted without metabolism. So there is a then induction and inhibition. There are short note about induction and inhibition of a drug metabolism. So drug A metabolized by enzyme X to its metabolite B. Clear? A হচ্ছে drug, B হচ্ছে metabolite, X হচ্ছে enzyme. If the action or production, so that means either function will be increased or amount will be increased by a third party. Suppose it may be drug C. If metabolite increase or decrease, if enzyme increase, metabolism will be increase or decrease. It will be increase. So if drug A is an active drug and drug B is an inactive drug and enzyme induction is there, so what happens? Yes, so there will be much more metabolism. Drug A is active, B is not active, inactive metabolite. So active drug will be inactive much earlier, much faster. So there will be therapeutic failure. There will be therapeutic failure. Now, suppose the drug A is a inactive drug, and drug B is a active component, and there is a increased enzyme induction. That means induction means either action of this enzyme is higher or there is a production of the enzyme. Clear? If it is higher, then what happens? Drug A is inactive, drug B is active. Then production of there will be toxicity. Clear? So what is therapeutic failure? Why there will be some drug with induction? Most drugs are there will be therapeutic failure if there is an induction of the enzyme. Clear? Director बोलता है. Drug A, which is the drug, and drug B is the metabolism. And for this metabolism, the H is the enzyme. Clear? Now, third drug, that is C, they either increase the action of the enzyme X or production of the enzyme X is increased. In either case, if drug A is active and B is inactive component, so what happens? There will be much more metabolism. So production of B will be higher than the shifting of this gradient here towards the B, and B is a inactive component. Right? So, what happened? There will be therapeutic failure. Clear? Now, example, oral contraceptive pill is metabolized by an enzyme which is induced by rifampicin. Rifampicin is a drug of so when these two drugs begin simultaneously, rifampicin induce the enzyme with metabolite OCD. So what happens? OCD will be metabolized much more faster. Clear? So there will be therapeutic failure of contraception. Clear? Even remember একটা drug A, morphine. Morphine metabolite 4-sulfate metabolite, 6-sulfate metabolite. It is an active, toxic compound. Active and toxic compound. Now the enzyme that metabolize it is induced by some third drug. So what happens? There will be much more excretion. There will be high concentration of metabolite, 6-sulfate metabolite of morphine, and that can cause neurotoxicity. So this is the toxicity. So depending upon the protein, is it a product, drug, or it is an active component, the effect of induction of enzyme can be changed. Now, what is enzyme? Enzyme is a carbohydrate or protein. It is a protein. So, for synthesis of this, it takes a shorter time or longer time. Okay? Protein synthesis it takes a longer time. So, for induction of enzyme, because it is a protein and protein synthesis is a time-taken procedure, the third drug that induce the enzyme will, if only not a single dose can induce. But in case of inhibition is the reverse process. The enzyme will be inhibited, so drug A to drug B will be less, conversion will be less. Then, now drug A is a active drug, drug B is a metabolite which is inactive. Similarly, if drug B A is a prodrug, there will be therapeutic failure. Clear? So this is the induction and inhibition. So induction and inhibition is the explained by previously came as explained by induction is a time taking procedure. Whereas inhibition it is very rapid also. Why? Because it only stops but destroy the formation already formed enzyme. Clear? Now there is a two type of enzyme, microsomal and non-microsomal. Microsomal means what is present? Endoplasmic. Non-microsomal এর বাইরে দেখুন কোথায় থাকতে পারে? প্লাজমায় থাকতে পারে। acetylcholinesterase. Acetylcholinesterase is a enzyme present in the as well as plasma, as well as butyrylcholinesterase present in the plasma. So most of the time, if inhibition is microsomal, it is non-specific type of inhibition. If it is microsomal inhibition, it is non-specific type of. Whereas when it is non-microsomal, it is much more specific. This inhibition is much more specific. Here inhibition কাকে বলে, induction কাকে বলে, enzyme induction inhibition মোটামুটি দেখা যাবে তো? Clinical importance of it, clinical importance দিতে depending upon the drug, if it is active or after injection, there will be therapeutic failure, there may be toxicity if there is a toxic metabolite or prodrug. তুমি ম্যানেজমেন্টের আগে তোমাকে বলতে পারবে যেটা কি হতে পারে। Why it is important? Because there most of the time there is a polypharmacy. Term called polypharmacy. What is polypharmacy? More than 5 or 6 drugs at a time. Primarily happen in the geriatric old age. There is a diabetes, there is a hypertension, there is a coronary artery disease, and this patient taken 5 to 6, even 8 drugs at a time. So if one drug induce metabolism of other drug, there will be therapeutic failure. If inhibit one drug's metabolism, it can cause toxicity. So this is the importance. We can predict the action of the drug when there is a polypharmacy. Depending upon that, we can choose drug of choice. The example of this, like when we give rifampicin with positive, either we have to do as it is a tuberculosis, national regime, follow that regime, we ask the patient give different type of contraception, maybe medical contraception or other type of, not any steroidal contraception. So it helps in therapeutic management. Clear? Induction, our inhibition hole, we have to reduce the dose of the drug so that we already know that if inhibit this drug and there may be high concentration. So there are chances of toxicity. Reduce plasma half-life and duration of the action. Next one is enhance drug tolerance. Third one is increase toxicity by enhancing the concentration of metabolite if the metabolite is toxic. Increase chances of drug interactions. Alter the physiological status of the animal due to altered metabolism of the endogenous component. Even if some drug that use metabolism sex steroids and that can produce gynecomastia or loss of libido for the males. So this is is the another chance. If a drug can induce metabolism of endogenous organisms like exosomes, that can also alter the physiological state. So, in the what is metabolism, where it happens, then what are the phases of metabolism, what are the actual effect of metabolism, active to inactive, inactive to active, active to active metabolism or toxic metabolism. Okay? And last one is enzyme induction, enzyme inhibition. What is inhibition and what is induction, and why induction is a longer process, whereas inhibition is a short-term process. So, drug first we absorb it, then it is distributed, goes into the target organ, then metabolized, and then excretion. So, primary metabolism or biotransformation is the part that helps to excrete. But if a portion of metabolism happens before going to the target organ,
that is our advanced drug nomination aims. ঠিক আছে, আমাদের ওটা কি লাইসেন্স ক্লিয়ারলি অ্যাপ্রুভাল হয়ে গেলে স্টার্ট করে দেবো। সো হোয়াট those centers do, they select areas. You already know, I think there is a hospital that is the building is actually developing by the management, and there is also outdoors. So whatever drug reaction we will see will report to this center, and this center will send it to the headquarters in Gaziabad. Okay, so I'm going to say something about the lunch and cabinet doctor, and secondly that report will so, but the thing is that, like say you are doctor, you are practicing in the OPD, and you are finding some kind of adverse drug reaction. So how will you inform this person who is sitting in the MC that I have got that area? There should be a particular protocol for that. So you have to write down a particular, you have to fill rather a particular form, that is adverse drug reaction, a suspected adverse drug reaction form, and that form will be submitted. By that you will also you can go it by by this hard copy thing, or you can have an app in your mobile, and so mobile is the app that you can submit. So you have to know in undergraduate you have to know how to actually fill the form. এবারে পরীক্ষা কি হবে, you are supplied with a particular problem, particular case scenario, and from there you have to write down that particular form, you have to fill the particular. Also that goes without saying, there will be many misleading things will be there. You have to with actually limited amount of time, you have to actually see what is required for filling up the particular form. There are it is rather difficult. So this is the overview. কি আমরা করব সারা এক বছর ধরে, যদি এক বছরই থাকে, তার কারণ বিকজ অফ করোনা দ্য শিডিউল ইজ কমপ্লিটলি ডিসরাপ্ট। ওকে, তো ড্রাগ মাল্টিপ্লিকেশন এর সাথে হবে AdCom. You have already known the term AdCom. So there are some AdCom modules for pharmacology also. Like say particular drug delivery system, how will you perform drug delivery? All you I think know. And so what is the proper use of a oral contraceptive pills, emergency pills? How will you counsel the patient? That you need. Last time the arekta is additionally added with how to deal with medical research. Yes. So medical research, that is also a very important part, because there are certain attractive rewards for writing on particular brand. So how will you actually counter these all things so that you are not going into a legal problem? So that knowledge follow. So drug dosage from practical class. So this is the first practical for your group. So myself, Dr. Arjun Ghosh, Assistant Professor, Department of Pharmacology, Santiniketan Medical College. So the thing is that drug dosage form. So you already know about drug. This term. So what is drug? What is drug? This is the very important actually definition. You have to remember drug at least for the next month, because in the Viva this might be someone's passport. What is drug? Each person basically a drug. So what is drug? Graduation is explore physiology, but yes, actually only one point is there, and any other modify and explore physiological state. আর ড্রাগ কি আমরা খালি ফিজিওলজি মানে যেটা আনকমন সেটাই আমরা ফার্স্ট বলেছি, কমনটা প্যাথোলজিক্যাল স্টেটকে আমাকে মডিফাই করতে হবে না, আই হ্যাভ টু ট্রিট দ্য পেশেন্ট। এখানেই শেষ না, আবার এই মুভি লাস্টে যেটা অ্যাড করতে হবে ফর দ্য অফ দ্য রেসিপিয়েন্ট, ইউ হ্যাভ টু অ্যাড দিস, কারণ উই উইল নট দ্যাট উইল ডু হার্ম টু দ্য পেশেন্ট। ওকে, so everybody I think already present. আচ্ছা, এখানে একটা দেখিয়ে দিলাম। So this is the book, I think অনেকগুলো বই আছে, তোমাদের যা চয়েস সেটা তোমরা সেগুলো নিতে পারো, তবে আমরা এটা মোটামুটি ফলো করবো ভেবে রেখেছি। এরপরে যদি নতুন কোনো ভালো বই আছে you can we will suggest according to that, ঠিক আছে? And books, what book do you read? The Pharmacology, yes. Pharmacology is a very good book. You can actually read, but the problem is that the format of the book. So তোমরা কি দেখেছো শুনেছো কি ডেন্স ফরম্যাট, মানে ওটার ভিতরে পেনিট্রেট করাটাই খুব ডিফিকাল্ট, আর মনে রাখা তো ছেড়ে দাও যখন পড়ে তখন বুঝবে। So other alternative books এর মধ্যে no, Sanbak is not actually your, it is for nursing students. You have completed pharmacology, you know your concepts well, you have prepared not, then you go for Sanbak for the last 24 hours. That is what next, what you can follow. There are two books there. One is your that one, that is actually is the shorter version of pharmacology, but with a more actually format which by which it is represented, it is very easy to remember. And general pharmacology, for general pharmacology you can actually read the format. You can page of the format GRG টেক্সটবুক আছে, আমি দেখিনি। GRG থেকে যেটা তোমাদের করতে হবে, তোমাকে এটা নিতে হবে এমসিকিউ বইটা, এমসিকিউ বইটা। এবারে সেইটা একটুখানি because what is happening is that you know about next I think entrance examination. So the thing is that MCQs actually given by the aims, okay? And what happens, the thing is that A, B, C, D, those four options are not very different. Might be there might be 2 or 3 options in might be correct, ঠিক আছে? এবারে ওরা কোনটা কানেক্ট করছে সেটা বোঝা খুব মুশকিল, and you need depending on the explanation will be having that answer, ঠিক আছে? So Govindra got it is a tried and tested book, so I think that is that for MCQ purpose that will be suffice. Till now একবার দেখে রাখলে the confusion সেগুলো আমাদেরকে জিজ্ঞেস করতে হবে। আচ্ছা, so drug definition, what is acha NMC competency? So today we will enumerate, identify drug formulations and drug delivery system. So drug delivery system, we will not go into details in the drug delivery system because in the next class we will got routes of drug administration. So drug delivery system will be much beneficial if we will actually give you idea about routes and then go into drug delivery system. Okay. So drug definition. So you have varieties of modify and explore physiological system, and along with that pathological states for the benefit of the recipient. Now you tell me what is physiological system modifying effect of the drug? Our pathological state ke modify kori, that is no problem with that. Fever hoyeche, temperature bede geche, paracetamol dichi, fever কমে গেল. That is modification of the pathological state. But what about physiological state? For example, যেখানে physiological state patient এমনিতে patient বলা যায় কিনা সেটাও একটা মানে বলার কারণ তার কোনো রোগ নেই। Yes, yes, contraceptive. So this is modified. So what is explored then? So explore করা হয় না contraceptive. So explore physiological system, pathological system. Explore means what? Discover. Right? তাহলে ধরো পেশেন্টের have a brain tumor. Okay, so the investigation of choice is either CT scan or you can go for MRI. Okay, but the thing is that CT scan, MRI, if you do not administer contrast medium, you will not able to see the thing very clearly. So you have to give some contrast medium or dye. So that dye is the drug which is used for exposure. ঠিক আছে, এবার অবশ্যই যদি সত্যি ব্রেন টিউমার থাকে তাহলে প্যাথোলজিক্যাল স্টেট মডিফিকেশন হয়ে গেল, যদি না থাকে তাহলে ফিজিওলজিক্যাল সিস্টেম So these are the examples that you need to know. তার কারণ ড্রাগের পরের কোশ্চেন এটা ঠিক আছে। So what is dose? So we learned about drug. Now what is dose? So dose is a particular amount of drug that you need to take in a single administration. Okay, so appropriate amount of a drug needed to produce certain degree of response in a given patient. Single তুমি কতটা নিচ্ছ, that is dose. Okay, imagine if there is no dose, there is no concept of dose, তাহলে কি হবে? Previously, yes, either toxicity or yes, exactly. আমি বুঝবো কি করে আমার কতটা নিতে হবে? Because if you go back to the history, you will find that every drug is present there in a crude form. Thereafter, we have modified the physical characteristic by which we have come up with tablet, capsules, তার আগে পাউডারই ছিল অথবা সলিড রকের মতো জিনিস ছিল, এই জিনিসগুলো লিকুইড ছিল। তো সেটা গঙ্গার মতো খেতে হলে if you do not know, then how the effect will be there. Okay, so that is dose. Now it is dosage form. So dosage form, what is dosage form? Dosage form, it is a product suitable for administration of a drug to a patient. তার মানে these are the actually these dosage forms enables us actually to take the drug in a convenient way. Otherwise, we will not be able to take the drug. Like say common things you already know, I use tablet, capsules, injection, suspension, syrup. These are all different dosage forms. All okay. So common question that is asked in the Viva that what is dosage form? First you have to give exam definition and thereafter what is dosage. এটা মানে give an example of dosage form. এটা সবথেকে simplest একটা question. কিন্তু because you have some conceptual problem, so you not able to answer it. ঠিক আছে, তো dosage form বললে you have to say this tablet, capsules, injections. Okay. Now what is there within a dosage form? So if you take a paracetamol tablet, you will find that it is not only paracetamol that is present there. Along with that, some other things also. You take a paracetamol tablet of 500 mg, weigh it in a balance, you will find that it is not 500. It is like probably 1 gram. Karon, you have some excipients there. So active pharmaceutical ingredient and excipient. So active pharmaceutical ingredient is the main pharmacological ingredient of that particular dosage form that is required for your particular disease, treatment of particular disease, and the excipient is an add-on material which helps the active pharmaceutical ingredient to maintain their shapes, to alter their particular physical characteristics so that we can take the drug. Otherwise, we will not able to take the drug. So excipient should be an inactive pharmaceutical ingredient. So this is very important. Why this is very important? Because sometimes what happens, these excipients may not be inactive. We do not know, but it is not desired. Okay, so you might have this having allergy with a particular dosage form of a particular drug. Other dosage form of liquid injection. tablet players are allergic because you are sensitive to that excipient, not the pharmaceutical. So this is why it is very important. So what are those actually? What is the function? So it is mainly added due to technological purpose, biopharmaceutical and stability reasons. So most commonly is because of stability reasons. Because you know what should be the range of a particular drug expiry date? It is from manufacturing date at a general rule বলছে 2 বছর ঠিক আছে এইবারে ঠিক আছে আমি আপনাদের দেব diluent fillers. So what are the different types of excipients? So you have diluent or fillers, means that you have some tablet of 0.5 ml. Thyroxine, you know about thyroxine. So thyroxine is, the dose is 75 microgram. So a patient, if you give the tablet with only 75 microgram, patient will not be able to see this. देखते ही कौन खाओ तो पूरे डोज को. So that is why we require something which is pharmaceutical, actually inactive, to add with that particular tablet and make it visible at least. Okay. So we have binders. Okay. So I have already told you the drug is proved from most of the time is powder. So from that powder you need to actually prepare tablet. So how it can be done? You need a binder for that. যাতে জিনিসগুলো মলিকিউলসগুলোকে ধরে রাখতে পারে একটা জায়গায়, আদারওয়াইজ তো হবে না. Next you have lubricants, you have disinfectants, you have coating materials. Certain tablets have got coating outside. Okay, and that coating material, if you break that coating material, the drug might not do their normal function. ঠিক আছে, ফার্মাকোকাইনেটিক্স কোর্সে অ্যাবজর্পশন অলরেডি একদম পড়া হয়ে গেছে. So coating material breakdown করে গেলে তার disintegration, dissolution might be occurring in the stomach itself. এটা intestine অবধি যাচ্ছেই না, absorption is. So that is why coatings are required. Preservative, stabilizers, colorants and flavoring agents. So probably in your 11, 12 or 9, then I don't know which class they have taught you. You have part about Cinchona. Malaria. So you already know how much bitter taste it is. Imagine you have to take that thing in a powder form and the patient will vomit. Patient already having fever, already they have nauseous effect, symptoms are there. So that is why this flavoring agent comes into picture. They coat it whole with some sweet or any other flavoring agent. So it becomes somewhat pleasant. Now what is formulations? Diluent fillers মানে কি আমাকে ফিল করতে হবে. So we have 75 microgram of thyroxine. So microgram, if you measure it, you will not find it. সেটা তো কিভাবে খাবে সেটা আলাদা ব্যাপার, যে দেখতেই পাবে না. So that is why we need to add volume to that. ঠিক আছে, so that is why you have fillers and diluents হচ্ছে যে তাকে আমি জলের মধ্যে ফেললাম, সেটা dilute হয়ে যাবে. অনেক সময় যেটা হবে, there are various actually pharmaceutical agents which are not soluble to water. Maybe oil soluble হতে পারে. So সেটাকে solubilize করার জন্য we need a particular agent. Now formulations. So formulation, what is formulation? Consists of drugs name, strength and dosage form. So whole of these things, tablet, paracetamol, 500 mg, that is your formulation. তার মানে এখানে কি আছে? Tablet, dosage form লেখা আছে. ঠিক আছে, paracetamol is the drug's name, active pharmaceutical ingredient, and 500 mg is the dose. Okay, so all these three come together to form formulations. Okay? Now you see that tablet paracetamol 500, 650, infusion paracetamol 1000 mg per 100 ml, suspension paracetamol 120 mg per 5 ml. Good. Infusion is for your parenteral purpose. Okay. Now suspension is for oral use, mostly, because you can imagine suspension means what? You have solution, you have suspension. Solution and suspension, the basic difference is that the solute and solvent are present in a exact amount so that they are actually mixed in a solution. There is no precipitation. But for suspension there is precipitation. The solute is much higher in number compared to that solvent. So of course if you inject it through IV, what will going to happen? that particular agent is going to be dissipated in the blood circulation, and that will cause topic inflammation. So same drug but different formulation. Okay. So you can understand what actually the difference between formulation, dosage form, and dose. It is a separate component. Okay. So এটা দেখে নেওয়া প্রবলেম হিসেবে এখানে তো একটাই জিনিস বলবার সেটা হচ্ছে গিয়ে you have here saccharin. So the thing is that what is saccharin? Artificial sweetener, and you know that this is like type of diabetes mellitus. So most of the time what doctors actually prescribe that if you have diabetes mellitus, do not eat sugar. Okay? The problem is that some people do not take tea without sugar. Problem is that. So in that scenario, open doctor actually prescribes some artificial sweeteners like saccharin, aspartame. Now the problem is that they are not actually produce any problem in short term use or low dose use. But the problem is that when they are used regularly for a long period of time, they might they can produce actually cancer or carcinogen. Yes. Atom people, solving carcinogen actually এখন আমরা খুব পাইনি সেটা. What is the advantage or function of the dosage form? এত কিছু করে আমাদের dosage form করার দরকার নেই. আমরা তো এমনি সেই ফুড পাউডার ফর্মে নিয়ে নিতে পারতাম, লিকুইড ফর্মে নিয়ে নিতে পারতাম. So there are few advantages. First of all, you are making the API with the help of dosage form to suit your drug administration to different ways. You know there is different route of drug administration. You have the oral tablet there, you have injections there. Our topical same drug they are there. Now the thing is that if you are giving similar example to Bola, so that is beta test drug. So what dosage form enabling us to make that particular drug less masking the beta test. Okay. Provide body to the drug. If you are giving thyroxine example to that is providing body. Now the তুমি পাওয়াই না দিতে পারে 75 মাইক্রোগ্রাম তো তাও ঠিক আছে, তার থেকেও কম ডোজে কখনো কখনো লাগতে পারে, ঠিক আছে? To provide liquid preparations of soluble substances in a desired vehicle, ঠিক আছে? So we have to make a solution, we have to make a suspension if we want to give a particular drug in a liquid dosage form. So how we can do that? Cannot do that without making the particular dosage form, ঠিক আছে? Next thing, to provide topical drug action for topical administration. Again, same ব্যাপার. At a particular drug, like say at a painkiller, paracetamol তো নয় হবে না. Diclofenac যদি তোমাদের জানো তাহলে পরে বলছি. Proveran বলে পাওয়া যায়, ঠিক আছে? Diclofenac. That is actually NSAID, painkiller. Now the thing is that it is available in tablet, it is available in injection. But the thing is that when you use tablet or injection, you might have problem in your stomach, ulcer. But that is not the problem with topical use. Cream হিসেবে দাও, gel হিসেবে দাও, that is no problem. So সেটা কি করে তৈরি হবে? Otherwise আমাদের dosage form না থাকলে we cannot produce that. Okay. Next, same thing happens with the inhalational route. We have drugs which can be given orally and inhalation. But inhalational route, we have the advantage is that the drug is acting much more rapidly. Okay, so we need particular dosage form to make us enable to administer through inhalational route. Next, injection, same thing. Next point, what is that? That is actually increasing the shelf life of the particular drug. Okay, so atmospheric conditions like say oxygen, moisture, humidity. These are the problems. At a medicine, the back side will be there. You will find that it is always written there as stored in a cool and dark place. So temperature that can affect, even dry humidity that can affect, and sunlight that can affect the particular drugs stability. Okay. Endogenous factors. So you all I think already know because absorption is already done. Most of the drugs are absorbed from where? From intestine, but to get into the intestine, parenteral drugs are used. to get into the intestine, you have to go through stomach, and there are various drugs there which cannot actually withstand the acidic environment of the stomach, and that is the reason you have to give some protective covering over there. ঠিক আছে? তো যত গ্যাসের ওষুধ আছে তোমরা যা যা খাও সব কিন্তু ইন্টেস্টাইন থেকে আসে। ঠিক আছে? একমাত্র গ্যাসের ওষুধ যেটা স্টোমাক থেকে কাজ করে, স্টোমাকই ডাইরেক্টলি কাজ করে, দ্যাট ইজ ইউর অ্যান্টাসিড। ঠিক আছে? So the thing is that there is a protective coating covering over the particular drug, and that is the reason they can reach to the intestine. Otherwise, acid নষ্ট হয়ে যাবে। ঠিক আছে? Next, to extend the duration of action by controlled release mechanism. I mean, it is a demarcate single dose. So, have you taken what is? What is means? So the thing is that how you have used what is key direction page take you have used what is না সে তো অবশ্যই বানিয়েছে কোনো আমরা বুঝতে হবে মালপান্তের বেশি জানে অ্যাকচুয়ালি। So first of all, first question first. What is the packaging? Powder form is okay. Now imagine what is this package like it same using the same container as the glucon comes. যদি আসতো তাহলে কি হবে? তখন কি হবে? You cannot understand how much you need to become. তোমাকে 3 চামচ করলেও সেই 3 চামচের জায়গায় 3.5 চামচ হলে পরেই what is the concentration change হয়ে যাবে। মানে huge difference হয়ে যাবে। So that is the reason there is a particular package that is for single dose. Okay? So that's why it is important. Demarcate single dose. আগে এরকমই হতো, রোজ 19-20 হয়ে যেত। তাতে কিন্তু পেশেন্ট ছাড়তো না, পেশেন্ট ইভেন সাইড এফেক্ট অ্যাডভার্স এফেক্ট হতে পারে। লাস্টলি এটা যদিও দ্যাট ইজ নট এজ মানে তোমাদের যদি এটা আসে কোনো এক্সামে এইটা কিন্তু ফার্স্ট শুরু করবে, এটা কোনো সাবস্টেন্স পার্টি ড্রাগ আইডেন্টিফিকেশন থ্রু ডিস্টিংটিভ কালার শেড অর নাম। কেউ কোনোদিন আউটডোরে আমাদের সাথে বসে দেখবে পেশেন্ট এখানে, তাও কলকাতার সাইডে দে অ্যাকচুয়ালি ক্যান মেমোরাইজ দ্য নেম, বলে দেয় মানে 10 বছর 15 বছর সেম ওষুধ থাকলে বলে দেয়, কিন্তু এখানে বলবে যে সাদা মানে ছোট ট্যাবলেট। ওকে, সো ইউ ক্যানট আন্ডারস্ট্যান্ড। সো সামটাইমস দে উইল কাম উইথ কোনো প্যাকেট কিছু নেই, খালি ট্যাবলেটটা নিয়ে হাতে নিয়ে চলে আসে। সো সামটাইমস এক্সাম্পল আমি তোমাদের দিতে পারি, দেয়ার ইজ এ ড্রাগ কল্ড আই ডোন্ট নো whether you have heard of it or not, মানে আমি খালি ব্র্যান্ড নেমের কথা বলবো এখানে, বিটালক। ঠিক আছে, বিটালকের ট্যাবলেট যদি কখনো দেখবে সেটা কিন্তু অ্যাকচুয়ালি হার্ট স্ট্যান্ড, হার্ট শেপ। সো জাস্ট জিজ্ঞেস করেই বুঝে যাবে যে হ্যাঁ এটা অ্যাকচুয়ালি বিটালক আছে। কোনো ড্রাগের উপরে লেখা থাকে, দেখবে P650 লেখা থাকে। সো from seeing the drug you can understand. Okay, এইবারে you ask the patient, like say infusion চলছে একটা, you go into the ICU, you see a person is getting some infusion with a like a silver wrap is there covering the whole of the body. You do not need to go treatment sheet and see what is the drug. You can easily tell that this is microdosage because that is going to be affected by sunlight or light. Okay, so somewhere this can be helpful, but that is unscientific. You have to check the okay, so classification of various dosage forms. So we have solid dosage form, we have semi-solid dosage form, liquid and gas. Okay. Now the thing is that we have only compiled this much, but there are several others. Even when you complete the pharmacology whole course this year 2023, again some dosage form might be added in between. Okay. So that is why it is actually ever expanded. So আমরা খালি এই কটা জিনিস বলছি, ঠিক আছে? So first of all we go for solid dosage form. So we have powders. So we have powder. So what is powder? Definition. So powder is basically mix of one or more solid substance reduced to a fine state. Okay. What is তোমরা already faced So you have seen that powder. So this is what is. আলাদা করে দেখানোর কিছু নেই, ঠিক আছে? This is what is, and this is actually this powder. And now powder can be classified into two different types. One is simple powder. Simple powder means this one. Okay, phosphomycin is the antibiotic powder, or you can have this one. So this is povidone iodine powder. Okay, iodine powder. So only iodine is the pharmacologically active ingredient. Phosphomycin is the only pharmacologically active ingredient. But this is the compound powder. Why it is compound? Because it has got several ingredients which are pharmacologically active. Like say it has got glucose, it has got trisodium citrate, it has got sodium bicarbonate, so all is there. Okay, sodium chloride, so potassium chloride, so all are there. So simple and compound powder. Now what is the so we can have all our drugs in a powder form, but what is the problem? Problem is that each dose to be tapped separately. Okay, so imagine what is some doctor you have prescribed you take what is এটা তো এত ছোট হয় না, একটু বড় হয় এটা বাচ্চাদের, ঠিক আছে? তো have prescribed you use 3 sachets of ORS 3 times daily for 5 days. মানে 3টে করে খেতে বলছে অ্যাকচুয়ালি, তাহলে 15টা তুমি ওই ম্যাগি ইয়ের মতন প্যাকেট মতন নিয়ে চলবে। এবারে ধরো you are staying in the hostel and unfortunately your exam has finished, and at the evening while all other your friends are going to cinema, এখানে সিনেমার কোনো লোক নেই, আছে তো ঠিক আছে, কিন্তু অবশ্যই কলকাতার মতন তো নেই। So all have gone to go, enjoy their evening, but you are there in the hostel, you are suffering from diarrhea. Okay, now in the next day you have already have booked a reservation ticket in the Shatabdi, which is very much expensive, so you cannot cancel that, but you have to take all that orders. এবার চিন্তা করো কি হবে, খুবই মানে এখান থেকে যেতে মোটামুটি 4-5 ঘন্টা লাগে, তো তোমাকে সব ওয়ার্ডসের প্যাকেটগুলো থেকে একটা ওয়ার্ডস বার করে সেখানে জলে মিশাচ্ছ। So that is very inconvenient. Not only inconvenient, this also increases the price of package. একটা ট্যাবলেট যদি ওয়ারেসটাকে কোনোদিন ট্যাবলেট ফরম্যাটে করে দেওয়া যায়, তাহলে পরে your cost of that particular ওয়ারেস powder will decrease. Okay? So increase cost and inconvenience, and not suitable for dispensing. Imagine it is not ওয়ারেস, it is queen. তাহলে কি হবে? তো মানে রিফ্লেক্সে এটা দেখা যায় যে লোকে মনে করতে শুরু করে, কারণ ম্যালেরিয়া তো কমন ব্যাপার, ম্যালেরিয়া তো হয়, তো নট সুইটেবল ফর dispensing unpleasant. Okay, but it is useful. Why? Because এখানে যদি আমি দেখাতে পাচ্ছি না যে চিলড্রেনদের টোটাল if you actually add up all the ingredient, all the powder weight, ORS will weigh for single dose 21 grams. So 21 gram you cannot actually put it into a particular tablet. So that is the reason large quantity of drug will be into powder. So this is powder, and we are talking about oral. Okay. So this is powder. Now there is a specialization or modification of the powder যেটা আমি তোমাদের দেখাতে পারবো না এখানে, but I think you have used effervescent powder. So what the term effervescent means that whenever you put the powder in a water, it is producing bubbles. Okay, so that is effervescent. Can also because they have got bicarbonate or cyclic or tartaric acid. যেগুলো react with the water and produces carbon dioxide. So that is why. And it makes the drug palatable. Not only palatable, it is also making the drug very easy to absorb. You know, tablet goes into the system, is first disintegrated, first dissolved. Palatable things, it is easy to actually absorb, easy to take orally. So I think So is actually your effervescent. Exactly, ওই কারণেই করে যেহেতু এটা একদম তাড়াতাড়ি। So next we go to different tablets. So what is tablet? Tablet is the powder plus binder, and thereafter we are compressing it. And if we can add some flavoring agent, coloring agent, that is okay also. And we are compressing it to produce particular shape. You know, tablet can be available as different shapes. It can be oblong, it can be round shaped, okay, or it can be কেউ কখনো ওভাল স্কোয়ার শেপের দেখেছেন? কেন বলো তো মাইনাস স্কোয়ার শেপের? Yes, সলভ করতে প্রবলেম হবে, ঠিক আছে, ডিসইন্টিগ্রেট করতে সমস্যা হবে, ঠিক আছে। নাও উই হ্যাভ টু লার্ন অ্যাবাউট প্যাকেজিং অফ দ্য ট্যাবলেট, ওকে। তো এখানে একটা জিনিস বলে রাখি, দো ইট ইজ রিটেন, দ্য প্যাকেজিং ইজ রিটেন ইন দ্য ট্যাবলেট, বাট ক্যাপসুলস অলসো ফলো দ্য সেম, ওকে। তো প্যাকেজিং দুটোর ক্ষেত্রে সেমই থাকে। তো ফার্স্ট অফ অল আমাদের কি প্যাকেজ বলেছে? ব্লিস্টার প্যাকেজ। তো হোয়াট ইজ ব্লিস্টার? ইউ হ্যাভ সিন ব্লিস্টার, গায়ের মতো পোস্টার করছে, সো দ্যাট ইজ ব্লিস্টার। সো দিস ইজ দ্য ব্লিস্টার প্যাকেজিং, ওকে। ব্লিস্টার কেন? বিকজ দিস থিং ইজ actually just like the boils you were talking about, it is elevated, and within that elevation the drug is there, okay. So this is the blister, and you can see the drug bhetore ache dekhte pacchen, so that means it is transparent, okay. So transparent blister. Similarly this is also blister, okay, this is also blister. বেশিরভাগ drug এখন blister। কেউ কি স্যারিডন খেয়েছে কোনোদিন? The Saridon, that packaging is not this. ठीक है, अच्छा next কি আছে আমাদের? Strip packaging. So this is actually strip packaging. It is also blister, but it is non-transparent. দেখতে পাচ্ছেন এখানে দেখো, if we want actually we can clear it, এখানে করা আছে যদি আমরা ভেঙে ইউজ করতে চাই, ঠিক আছে। সো দ্যাট ইজ ইউর স্ট্রিপ প্যাকেজিং, ঠিক আছে। এই যে এখানে ভাগগুলো দেখতে পাচ্ছ তো, দিস ইজ স্ট্রিপ প্যাকেজিং, ওকে। নেক্সট ইজ হোয়াট? আলু। সো দ্য থিং ইজ দ্যাট, আচ্ছা, before actually employed by this medical college, I actually work in Article Medical College as a senior student. Okay, so there one during practical examination, I have asked one person that what is aloo packet. He somehow actually confused with potato. Okay, so I think you should not do the same mistake. So aloo actually is short form for aluminium. Like there is aluminium strip, so it is called aloo. Okay, so it is the short version. A side of aluminium foil, A side of aluminium foil. So that is your aloo. Yes. কোনো পার্থক্য নেই। প্যাকেজিং গুলোকে আমরা ডিফারেন্ট নাম দিয়েছি আমাদের। Okay. Next is bottle packaging. So this one is your bottle packaging. ঠিক আছে? So this is actually thyroxine tablets. So this comes in large quantity, 120 tablet এর ভিতরে থাকে। So you can see here এখানে ট্যাবলেট গুলো ভিতরে রয়েছে। So this is bottle packaging. Okay. So bottle packaging, why bottle packaging is there? Because যদি 100 ট্যাবলেট স্ট্রিপে দিতে হতো তাহলে সেই স্ট্রিপ নিয়ে সমস্যা হবে। So that is why bottle packaging, it is more convenient to carry. 100টা 120টা এরকম ট্যাবলেট থাকে যেগুলোর ডোজ কম ফ্লাকচুয়েট করে। So what is tableted key advantage? It is very convenient to carry, store and administer. Actually this is the cost, store and administer. That is why we prefer tablets. Okay. Now in the picture if you see there is a line you can see. So this is called scoring line, not football or cricket score. Okay. So this is the line which actually tells us where we need to give the pressure. এটা যদি দুপাশ থেকে প্রেসার দেওয়া হয় এই লাইন বরাবর এটা ভেঙে যাবে, ঠিক আছে। And that is very helpful particularly for elderly individuals. তার কারণ কি, যেহেতু এই লাইন বরাবর ভাঙলে পরে এর যে ভাঙা পার্টটা দ্যাট ইজ নট অ্যাকচুয়ালি ব্রেকিং ফার্দার। সো কেউ কেউ হতে পারে যে আগে থেকেই ভেঙে অনেকগুলো রেখে যাচ্ছে। So this is, and what is this number? This one is also actually asked by a UG student in Article. What is the number? This is nothing actually. এখানে P650 থাকতে পারে বা অন্য কিছু থাকতে পারে, ঠিক আছে? But this number for this particular picture is actually the particular mold that is used to create that tablet. সেই মোল্ডের নাম্বার। আবার কিছু, ঠিক আছে? এইবারে কিছু স্পেশালাইজড হচ্ছে কি ট্যাবলেটস। So first of all we have chewable tablets. So anybody in this room have corona infection? তোমাদের কারণ হয়নি corona? Okay, ছেড়ে দাও, কোশ্চেনটা একটু হচ্ছে। Have you ever taken vitamin C tablets? So there are some variants of vitamin C tablets which are chewable. Chewable means they are pleasant tasting, অনেকটা লজেন্সের ক্যান্ডির মতন খেতে, and you have to chew it. Okay, so chew and thereafter chewing it is swallowed. Okay, and must be pleasant tasting. Quinine and chloroquine tablet you cannot expect the patient to chew. Dispersible tablet এখন পাওয়া যায় না, আগে পাওয়া যেত ডিসপ্রিন, অ্যাসপিরিনের ডিসপার্সিবল ভার্সন। জলে দিলে পরে টিভিতে অ্যাডও দিত, জলে দিলে পরে দেখ মানে বুদবুদ উঠছে। So that is your dispersible tablet. This tablet is not swallowed like other tablets. This tablet you need to first dissolve in a water and thereafter you have to take. And because dissolution already has been done outside the body, so very quick, very rapid. Never ওখানে লেখা থাকতো যে 3 মিনিট তো বেশি হলো না, তারপরেও কম টাইম লেখা থাকতো, তাতে লাভ হবে। Sublingual tablet. So this one is the sublingual tablet, ঠিক আছে? So that is your isosorbide dinitrate tablet. এখন মনে রাখার দরকার নেই। This is the tablet which we use in angina pectoris patients. Means chest pain because of ischemic heart disease. Hearter blood supply যাচ্ছে না, যদিও heart deals with blood, but still it is not getting it. ঠিক আছে? So the thing is that sublingual tablet, the advantage is that sublingual tablet we need first of all for ischemic heart disease. We require action in where? We require action in heart, myocardium it is affected. Okay. Now, how the drug will reach to the myocardium? Anatomy to আমাদের হয়ে গেছে, so I can ask from where myocardium gets blood supply. Coronary artery. So coronary artery, from which ventricle the coronary artery gets its circulation. Now imagine the same tablet, one person has taken, same problem, same indication. One person has taken it orally and one person is just giving it sublingually. So what do you think? What is the fate is going to occur? প্রথমে যে ওরা নিচে তার ক্ষেত্রে কি হবে? First it reaches intestine, from intestine it is absorbed. Thereafter from after getting out where it is going? Total circulation. Thereafter where it is going? How? Systemic circulation आगे जाए ना, systemic circulation पड़े जाए. Liver. It is going to liver and from liver where it is going? What is the normal flow of blood from all over the body? Heart as well. Yes, heart as well. Through inferior vena cava. Okay. Now the thing is that the drug has to pass through intestine, pass through liver. These are the two main sites where 90% of the drug is getting produced. So the concentration of the drug that reaches to the heart is very minute and also time is slow. But if you keep sublingual, what will happen? এখানে যত ভেনা সব জায়গা থেকে ড্রেন করে superior vena directly it is going to the heart. It is from the right ventricle, it is going to the lung and thereafter it is coming. So very much rapid action, and even the advantage is that you take the drug sublingual, you have not swallowed it, you get fill, the remaining portion of the drug you can fill. ঠিক আছে, পুরোটা নিয়ে নিলে অনেকের মাথায় আসবে না, ঠিক আছে। তো সেগুলো আমরা আসবো পরে সিরিয়াস কন্ট্রোল, কিন্তু that is the reason why it is taken sublingual. Okay, so rapid action is what we want. Next is enteric coated tablets. So this is the rapid-trazole domperidone combination, proton pump inhibitor and one antibiotic agent. So it has got enteric coating. Now enteric coating, what it is helpful, what it is doing? Yes. Yes. It is passing through stomach and it is not getting degraded. Okay? So that is why enteric coated, it is named as enteric coated. It is going to the intestine in the small intestine and thereafter the coat breaks. Okay? Due to alkaline pH. Next is your sustained or extended release tablets. যদিও এটা ট্যাবলেটে দেখাচ্ছি না, এটা ক্যাপসুলে দেখাচ্ছি, ট্যাবলেটে আমাদের কাছে নেই, তো ক্যাপসুলের ক্ষেত্রে সেম ব্যাপার হয়, ঠিক আছে। সাস্টেইনড এক্সটেন্ডেড রিলিজ ট্যাবলেট, so here you can see this is actually what it is. It is iron zinc folic acid. দেখতে পাচ্ছ ক্যাপসুলগুলো? আচ্ছা, ক্যাপসুলে যে পার্টটা ট্রান্সপারেন্ট ইউ ক্যান সি, সামনে তোমরা দেখতেই পাচ্ছ কালার আছে, হোয়াইট কালার আছে, ব্রাউন কালার আছে। So actually what is there are particular those bits are also coated. এই যে ভেতরে যে ড্রাগ পার্টিকেলস গুলো রয়েছে সেগুলো কোটেড হয়ে রয়েছে, ক্যাপসুল ব্রেক করছে, বের হচ্ছে, বেরিয়ে তারপর ওরা নিজেদের রাস্তা, ঠিক আছে। Some of the particles will break down like say immediately after reaching to the intestine, some will let, yes. So what is the thing that is occurring, that is sustained release tablets or extended, the action is extended because it is absorbed very step by step manner, very slowly. Lastly, controlled release tablets. So we have controlled release tablets. Okay, so we do not have controlled release tablet, but the idea is same. It is just coating of a material which is sensitive to the particular pH, and depending on that, it is after reaching to that particular pH, it is getting dissolved, it is getting broken, and thereafter the release thing happens. Okay. So these are the examples. C500. So this is the vitamin C tablet. Okay. Nitroglycerin, piroxicam. So this is your dispersible tablet, which is actually painkiller, metformin, hydrochloride, sustained release tablet. So anti-diabetic agent. Okay. We will all come back to that. From your job for now is to just identify what is this. It is tablet in a transparent blister packaging, and it is, as per the packaging, it is a sustained release tablet. That should be your answer in my opinion. Next we go to the pills. So pills, there is a misconception. Actually now we do not have any pills. We do not actually go for pills. Keno? Karon hocche drug powder mixed with honey and syrup and make a sticky mass and rolled into spherical and oval bodies. Previously, when the pharmacist himself prepares medications, then this thing is there. এখন হবে না, কে হাত দিয়ে এরকম মানে গুটি পাকিয়ে দিচ্ছে, সেটা তুমি এসে খাবে। So that is not expected. Now the thing is that oral contraceptive pill is also pill, but that is not this pill. Pill, yes, capsule of the word, tablet of the word. We use pill as a general sense, interchangeably used. We are not actually meaning that this kind of thing. Now we go into capsule. So capsule has got a cylindrical structure mostly, and it is covered with gelatin. Most of the time it is gelatin. So there are two types of capsules there. So this one, but it is actually polycalciferol or gelatin capsule. So both are gelatin. There is no problem. The shell is both actually prepared by gelatin. But this one is soft shell because if you can press, you can see there it can easily compressible. Okay, it is a liquid rose. But here it is a hard shell gelatin. So there is drug particles in it. Okay, so this is the difference. vitamin A capsules are there, that is also your soft cell gelatin, your liquid cell. এখানে amnion, vitamin D, that is also your soft cell capsule. ঠিক আছে, কিছু কিছু soft cell capsule আছে. Now the thing is that it is কিছু বছর আগে, এক দু বছর আগে, there is a report that this gelatin is suspected to be a carcinogen, but that is not further followed up. ঠিক আছে, তো basically gelatin capsule নেওয়াটা ঠিক নয়, এটা ভুলে যেতে হবে. Okay. Next, anti-coated capsules I have already told you. Now capsules, so this is actually capsule. ঠিক আছে, তো একটু আগে যেটা আমি দেখালাম সেটাকে capsule ক্যাটাগরিতে রাখা যেতে পারে. So this contains granules of medication with different coating, যেটা that is increasing the duration of action, frequency of administration and compliance. Means that, like say, you have a combination capsule. There are 2 or 3 drugs there. One drug is need to act faster and another drug will need action in a little bit slowly. So instead of giving 2 drugs separately, you just give capsule, you produce capsule and you give that person that particular drug, and what will happen, the coating material will get dissolved for the rapid acting ones very fast and the slow acting ones very slowly, and that is why you do not require further dose of that particular drug. So frequency of administration decreases. In elderly person they are already taking like say every day 10 tablets. Further, so our job in elderly person is to decrease the number of pills. যত পিল বাড়বে তত একটা কস্ট বেড়ে যাবে, আরেকটা যেটা হবে সেটা হচ্ছে যে পেশেন্ট ভুলে যাবে এতগুলো ওষুধ নিতে পারে না। তার সাথে এখন রিসেন্ট কয়েকটা রিপোর্ট আমি দেখেছি যেখানে লেখা আছে পিল বেজোয়ার। বেজোয়ার জন্য হোয়াট ইজ বেজোয়ার মানে দিলে তো আমি নিয়েছি ওষুধটা, কিন্তু সেই ওষুধটা স্টোমাকের ফাইব্রাসে গিয়ে আটকে গেছে, যেটা ইন্টেস্টাইন দিয়ে চলে। ঠিক আছে, যখন আমাদের অপারেশন করতে চলেছি the tablets remain in there undissolved. তার কারণ হচ্ছে যে ফাইব্রোসটা তাদের ক্ষেত্রে রেসপন্সিভ নয়, ঠিক আছে, এবং ওষুধগুলো ওখানে গিয়ে ক্লাম্প হয়ে গেছে সামনে। বেজোয়ারে কি হয়, বেজোয়ারে যে কোনো অন্য ম্যাটেরিয়াল হয়, পিল বেজোয়ারে ড্রাগের ট্যাবলেটের জন্য ক্যাপসুল ট্যাবলেটের জন্য, ঠিক আছে। অ্যাডভান্টেজ কি, total capsule stability is increased, overall problem of taste. So you are swallowing just a gelatin capsule, gelatin shell. So there the gelatin shell do not have any problem, you can easily take it, there is no taste of that. Disadvantage, cost is increased. So of course এটা বানাতে গেলে পরে actually proper mechanism, proper machinery, that is why. Lozenges, so আলাদা করে কিছু বলেন, you can, I think you have all have taken. So capsules, yes. So capsules mainly what the lozenges do, you have to lick it to cells, and they are some materials, they have some materials which actually make a soothing effect in the throat. So irritation is lost, irritation is not there. That is why we actually have lozenges, Alex lozenges, capsules, and this medication is costly. মানে লজেন্স বলে যে কম হবে সেটা না, এটা একটা ট্যাবলেটের দাম 10 থেকে 15 টাকা।
So Vicks গুলো কি থাকে একদিকে ওরা
Vicks is not a pharmaceutical ingredient, do not have any. This one have. Maybe same কাজই করে, কিন্তু we modern medicine we cannot actually recognize Ayurvedic things. So that is why. Suppository. So we have suppository. Have you ever taken suppository? কারো কিছু দুর্ভাগ্য হয়েছে suppository নেওয়ার মতো? So this one is suppository. দেখতে অনেকটা বুলেটের মতো, and অবশ্যই যদি এরকম শেপ হয় সেটা কোথা দিয়ে ঢুকবে বুঝতে পারবে, ঠিক আছে? So this is suppository. The thing is that it is just like a material which is containing the drug which is actually in a cylindrical conical shape. Now the idea behind that, it enters through the anal channel, okay, and with the core body temperature, using the core body temperature, it gets dissolved and it is then absorbed. What is the advantage of that? So you know about internal hemorrhoidal veins, external hemorrhoidal veins. So the blood supply from external hemorrhoidal veins goes where? External থেকে কোথায় যায় আর internal থেকে কোথায় যায়? External সিস্টেমিকে যাবে, ইন্টারনালটা ইয়েতে যাবে। So by giving this, we are actually avoiding total system and liver. So first metabolism তোমরা আজ আমি জানি না বলছি কিনা। So first metabolism is not avoided by this. Okay, and another advantage is that বাচ্চাদের ক্ষেত্রে ছোট বাচ্চা মানে ধরো 1-1.5 বছর, you cannot go for IV line, you cannot give them injections. ওরা তো যে অবস্থার কথা আমি বলছি তাতে ওরা দেওয়ার কোনো অবকাশ নেই। So the thing is that you sometimes you need to give through this supposition, particularly diazepam. Diazepam is an agent which is anticonvulsant and sedative action. So have you heard a particular disorder in little child called febrile convulsion? বাংলাটা হচ্ছে টর্কা, ঠিক আছে? টর্কা জ্বর আসে, হাই ফিভার and তার সাথে epilepsy convulsion. So in those patients diazepam is very effective, so it is given in a supplementary format. কারণ তাদের ক্ষেত্রে ব্রেন ড্যামেজ হতে পারে খুব মুশকিল, আর এটা লাইফ থ্রেটনিং সিচুয়েশন, ব্রেন ড্যামেজ ইজ গোইং অন। Now suppository are for anal channel, the route of administration is parenteral. Okay, now if this thing will go, if we give through urethra, then it is called for if it is administered within the urethra. ঠিক আছে, ভাবতে একটুখানি গাছটা সৃষ্টি করতে পারে, কিন্তু that is the thing, খুবই দেওয়া হয় সেম জিনিস, এটার মতনই জিনিস, জাস্ট এটা অ্যানাল ক্যানালের জায়গায় ইউরেথ্রাতে ঢোকানো হয়। অবশ্যই এটা এরকম এতটা গাঢ়ের হবে না, and pessary is for vaginal and administration. Okay, so we have pictures for that. So Dalcolax is one of your laxative targeting agent, and we have this clotrimazole metronidazole combination that is specially for vaginal delivery. Next we go to the advantage of solid. So what is the advantage? Obviously administration is very convenient, carry, storage, procurement all are very easy to, and for pharmaceutical company easy to produce in a large quantity. Mass production is very helpful. And what is the disadvantage? Disadvantage is it is of course slow absorption, because your drug is in a solid form and then it need to disintegrate, it need to dissolve. So that is why of course the compared to the gaseous dosage form, compared to the liquid dosage form, have slow absorption. That is also solid dosage form. Until that we are talking about dosage form. Dosage form means that pharmaceutical company what they are building and we are getting. We are talking about that. দেখবে ডাক্তারবাবু যখন লিখছে সে তখন কিন্তু ট্যাবলেটই লিখছে, সে কিন্তু রিজলভ ওই ঝিমতে করে খাওয়ানো হোক আর যেভাবে খাওয়ানো হোক ট্যাবলেটই লিখছে। So that is why that is solid dosage. Slower onset of action compared to liquids. এটা আমি বললাম। Next, liquid dosage form. So liquid dosage form we have aqueous. So we have aqueous dosage form, aqueous solution. So actually aqueous solution I do not have it. So basically the vehicle, the medium which we use to actually deliver the drug is actually water. Okay. So solution means there is no precipitation. Okay. So any aqueous solution agent you take, there you will not find there written as shake the vial. Okay. So it can be for oral, topical and parenteral purpose. So there we have an example of oral solution. But this is not the gargle preparation. এটা দিয়ে gargle করলে পরে পরের দিন আর শেষ হয় না। এটা এটা কেটে গেলে লাগানো যাবে। এটা gargle ইউজ করা যায়।
dilute solution আরো
yes dilute করতে হবে।
2% something
এখন অত দরকার নেই, আমাদের gargle solution পাওয়া যায় 2% এর Now suspension. So we have suspension here. So this is antacid suspension, or we can call it emulsion. So What is suspension? Suspension is that solute and solvent is there, but solute is much higher concentration compared to solvent. So they have a tendency to precipitate. So that is why you have to shake. Thereafter you take it. And emulsion, what is emulsion? Emulsion is two immiscible agents are there. কখনোই মিশবে না সেটা, like water and oil. কখনো মিশবে না. What you can do? You can shake it and you can have some other agent which is amplification. ঠিক আছে, একসাথে water হচ্ছে আর একসাথে oil হচ্ছে, ধরে সে এক জায়গায় সলিউশনে চলে আসে. So that is emulsion. This product, this is the antacid. This is emulsion. Okay. Next, elixir. So you have actually played Clash of Clans, I think. So there is a elixir. So this one is elixir. So you can see it is not purple. Purple to color টা ছিল elixir, কিন্তু এটা purple নয়. And for your information, this is hydroalcoholic solution. So it has got alcoholic percentage here. Okay. So you can understand why patient comes back repeatedly and asks you for this. Elixir, this is neobatic. This is used for fatty liver disorder, high cholesterol, appetite stimulator. But the problem is that this is a hydroalcoholic alcohol. So you probably could not give it to the diabetes. But now next we have syrup. Okay, so syrup is basically having sucrose glutamate. So this is your syrup. Okay, so this is actually cup syrup. Okay, dry cup. This one is for dry cup syrup. Okay? Next we go for drops. So drops. Now the thing is that, so we have in here multivitamin drop. This is kid drops. Means that it is used in children, and always this kind of dosage form supplied with this drop. Okay. So this is for parenteral intake. We have some adult drops also. So this is citicoline drops. Again, this is actually psychostimulant. Psychostimulant means that patients suffering from stroke, they have some cognitive defect and psychological problems. So we sometimes give this kind of drug. Stroke drop na এটা মুখের না oral drop. So oral drop, these are two. So sterility is not a question, but this one is your eye mist. So it is artificial here. So this is eye drop. Now the thing is that this one requires sterilization. This one is sterilization and maintenance of sterilization. That is very important. সেই কারণে we always advise that do not use others eye drop, ear drop or nasal. ঠিক আছে, infection can spread. ঠিক আছে, and another thing is that after blockage, actually after you break the cell, you need to actually within 30 days you have to actually complete and use for diabetes. So next we come into lotions. Unfortunately, we actually do not have lotions here. So have you ever used calamine, lactocalamine? So lactocalamine is, though it is considered as cosmetic, but it is actually one of the medications. Yes, it is used in cough, chicken pox. Okay, so calamine lotion is there. So this is solution or suspensions of emulsions of skin for skin application with rubbing. Now there is certain difference of lotion with liniments. Okay, so liniments is there in our museum. If you go someday, you will find that liniments. What is the extra feature of liniments compared to lotion? They actually have got counter indicator. Basically, we use it for any kind of pain. ঠিক আছে, এই যে টিভিতে অ্যাড দেয় যন্ত্রণা, না ওটা তো তোমার সেমি সলিড হয়ে যাচ্ছে, it is completely liquid. So what basically they are doing, they are actually reducing the pain in some amount. তার থেকেও এদের যে main function, they are actually stimulating the nerves surrounding the particular area. তাতে কি হবে, ও actually তোমার ব্যথা অতটা কমাচ্ছে না, তোমার চারপাশে আরো ব্যথা বাড়বে। burning sensation করছে, and that is why you will not actually identify that particular pain. Yes, so this is called liniments and it need to be applied with rub. This is very important. আমরা কিন্তু ointment, cream বা অন্য যেগুলো আছে সেগুলোর ক্ষেত্রে কিন্তু we will not call if you advise you to rub vigorously, but এখানে কিন্তু rub করতে হবে।
স্যার যদি পেইনটা কমানোর জন্য যদি অন্য কিছু সার্ভিস দেওয়ার লাভটা কি হবে?
হ্যাঁ,
পেইনটা কমানোর জন্য যদি বডি সেন্সিটিভ করে দেয় ওই জায়গাটা তাহলে আমরা
লাভ কিছুই নেই, because in some individual you cannot prescribe analgesics and sales. Elderly person who already have peptic ulcer disorder you cannot give. So in those patients it is very helpful, and in those patients who require continuous pain suppression, so dozer মাঝখানে যে period সেটা তুমি কি করবে, এটা দিতে হবে। So this might enable us to give the drug thrice daily থেকে twice daily or once daily তে নিয়ে আসতে আমরা help করতে পারি। That is the, and some in sports person they might not require any kind of medication for particular pains, only this thing will serve. Liquid dosage form, so liquid dosage form we have injections. So injection you all know there is ampoule with that. Okay, so liquid dosage form injection is actually supplied in 3 packages. So here we have ampules. So you can see a particular ring shaped structure is there, marking is there. Yes, so this is the weakest portion of this bottle. So it is supposed that you break that in this way. কিছুই না, জাস্ট এটাকে নিয়ে টেবিলের উপরে উল্টো মারলেই এই পার্টটা দিয়ে মারবে। So that is the reason it is there. Okay, and this ampoule is for single use. It is not a multi-dose vial. তার মানে you have to give a person all of this. ঠিক আছে, এবারে ডোজ ক্যালকুলেশন করে যদি দেখো কম হচ্ছে তাহলে পরে কিছুটা তোমাকে অ্যাডজাস্ট করে নিতে হবে। And this one is higher. Again, you can see it is not liquid. So actually, so this is actually powder. This is powder. So what you have to do, you have to take this distilled water, this is supplied with the injection. You have to inject it, this distilled water into this, and thereafter you have to reconstitute. Okay. Now the thing is that there is a special technique. Why? Because this is glass water, so it cannot compress. ভেতরে যেটা আছে সেখানে অলরেডি কিছুটা এয়ার আছে, so you have to actually administer that air in it suck out. এই তারপরে that will go, actually it goes naturally. Okay, and in this vial যদিও এই vial মানে শুধু আছে liquid injection এর vial, here you can see a cap is there and there is a seal is there, and there is a aluminum actually built peripheral ring is there, but again in the center you have rubber stopper, and this is a multi-dose vial. You can actually use it for giving 2 doses or sometimes. Now this is what is this? This is pre-filled syringe. It has methyl conductadinol. Conductadinol is an anticoagulant agent. So here already the injection, the dose is prepared in an injection. So just you need to give it administer directly into the patient. Okay? So this is your now there is a very important thing that you need to understand. This one. This is called, this is insulin pen, but it is also available for epinephrine also. Okay, those persons who have allergic reaction to like say peanuts, peanut butter or some whites, তাদের ক্ষেত্রে কিন্তু এই পেনটা খুব জরুরি, লাইফ সেভিং সাপ্লাই। So here you can see the needle, it shows for it is for subcutaneous. Okay, and here you can see there is a window. আমি বলে দেখাতে পারছি না, এটা অ্যাকচুয়ালি এরকম সাপ্লাই হয় না, কাউকে একটা স্পন্সর করতে হয়, এগুলো দাম আছে। So here there is a dose counter, here is a button by which you actually can adjust the dose, and you just need to press it. So the dose যদি 2 units থাকে বা ধরো 4 units রয়েছে, তাহলে after you press this 4 units come back to 0. Means 1 dose is delivered. And there is catechins. পেনে যেরকম catechins থাকে সেরকম catechins থাকতে পারে, or there might be a single use pen, use and throw. So the cartridge is not there and you have to change the bowl of this. So this is actually vial parts. Okay, আমরা আসবো এগুলোতে যখন আমরা তোমাদের শেখাবো এগুলো। So liquid dose, what is the advantage? First of all, it is the route. Liquid dosage we always use for emergency purpose. So rapid absorption from the site of administration and prompt action. Onset of action is very much prompt because precipitation dissolution not required. Disadvantage, what is the disadvantage? Disadvantage is that anywhere there is a liquid dosage form, the stability of that particular dosage form is reduced. You cannot store it for a prolonged period of time. It might be actually destroyed. So that is the reason. So, and it is relatively bulky. That not আমাকে পুরো সিরাপের বটলটা নিয়ে ঘুরতে হবে। So that is sometimes not possible or inconvenient. Okay. And taste and odor cannot be mass completely. যদি তোমরা ক্লোরোকুইনের একটা কুইনের সিরাপ নাও যেটা বাচ্চাদের ক্ষেত্রে অ্যাভেলেবল, সেইটাতে দিলে পরে কিন্তু তুমি হবে কারণ সেটাও বিটার টেস্ট। Now semi-solid dosage form. So semi-solid dosage form. So we have three: ointment, gels, and paste. Okay. So we have ointment here. So what is ointment? Soft and semi-solid prepared. So here it is semi-solid, not solid, not liquid. It is including this. So containing medicinal ingredient and ointment is always for external use. ठीक है, कहीं और जाएगा, ठीक है? अच्छा, so what are the vehicles can be used here? Mostly for ointments, these are oily vehicles. The medium is oily medium. Okay, so you can use paraffin, which is actually your petroleum compound, wool fat, beeswax. So all these are actually fat liquids. Okay, and that is why ointments are greasy. ठीक है, it will be chat. And it is not suitable for oozing surface, good for dry and chronic lesion. So if it is oily, it will actually can preserve the underneath water. Cannot cross করে বাইরে আসতে পারবে না, evaporate হবে না। So that is why ointments are not good for oozing surface, because oozing surface এ জিনিসটা যদি বাইরে না বেরোতে পারে তাহলে পরে কিন্তু প্রবলেম, ইনফেকশনটা prolonged হবে। Applied over the skin, eye, nasal mucosa, ear or anal canal. So this is eye ointment. So this is called eye. Okay, conjunctivitis because it is antiviral ointment. So viral conjunctivitis is used. Now we have cream. Okay, so cream is the same as the ointment, but only the thing is that in the base it is not a pure lipid or pure oil. It is emulsion of water and oil that is used as a base. Okay, so this is cream, and cream is less sticky and this is cosmetically hence it is very acceptable. দেখো সমস্ত মুখের ক্রিমগুলো মানে ক্রিম ফরম্যাটে আছে, এখন অবশ্য অনেক কিছু বেরিয়েছে, ইয়োগার্ট বেরিয়ে গেছে, জেল বেরিয়েছে, so you can use that also for face. Now gels, so this is your gel. The only difference is that the medium is gelatinous. Okay, and it is aqueous in nature. এটাকে জল দিয়ে ধুলে পরে এটা উঠে যাবে। So that is the reason it is one of the gel এখন choice বেশিরভাগ ক্ষেত্রে choice করা হচ্ছে for applying the face or in the pain. ঠিক আছে, আর this goes without saying, this is available in the collapsible tube. Suitable for dry skin, oral ulcer and better retain. Lastly, paste. We do not have any paste here. So the paste is that mainly non-greasy preparation and thick in consistency. Probably je kota mona problem tar moddhe সবথেকে thick consistency. And it is actually able to control oozing from the surface. So oozing surface, it is the choice of the dosage form. And the thing is that have you ever have any patient or any relative elderly person on, let's say, inhaler for a prolonged period of time having candida infection in the mouth? So in those cases we can actually have paste, antifungal paste we can because immunity is suppressed, so candida is not so severely pathogenic for us, immunocompetent ones, but immunocompromised you will get infection. So this is the gel, diclofenac gel. So this is ointment and cream I have already shown you. Lastly, we go into the gases. Now gases, oxygen, carbon dioxide, nitrous oxide, I will not teach you. You already in the chemistry, I think chemistry or physics. তোমাদের সিন আর এটা করতে হয়েছিল তো সিলিন্ডারের কালার আর উপরে ফিল আমাদের সময় ছিল তোমাদের সময় ছিল না so the thing is that oxygen, carbon dioxide and nitrous oxide, those are the agents which we most commonly use in our medical sciences. বাকি যেগুলো দেখছো সেগুলো মোস্টলি অন্য জায়গাতে ইউজ হয় chemistry lab. So oxygen, always oxygen cylinder, you have got black body and white color or white shoulder. Okay. For carbon dioxide, you have this one. ঠিক আছে, carbon dioxide gray, all is gray. যদিও এখানে gray মনে হচ্ছে না। carbon dioxide cylinder কখনো কখনো আমরা oxygen carbon dioxide একটা combination করে দিতে লাগে। carbon dioxide is actually respiratory cylinder. ঠিক আছে? Nitrous oxide, nothing less. So it is blue. And also dentist, dental. Nitrous oxide. Nitrous oxide, I think the effect of nitrous oxide is that the vocal cords are actually not acting what it should be acting, and that is why the voice is altered. Helium will over bass. তবে nitrous oxide is a very good anesthetic agent. Okay, we do not use it nowadays. কিন্তু তাও এখন কাফিং এর সিএতে ইউজ করি dental imaging. আচ্ছা, aerosols, so we will not go into the details of aerosols because this one we have in our AdCom module. So a patient is going to actually describe how to use it. Okay, so this one is inhaler. So this is actually drug in an aerosol format. In the canister actually. So this is the canister. You get. It actually specialized actually. This one is canister. Canister contains a propellant and the drug particles. Drug particles here it is in liquid. But when we are actually actuating it, it will become aerosol. So that is your aerosol. Okay. Next you have, so this is pressurized meter dose inhaler. Why it is pressurized? Because propellant is there. Why it is metered? Because a particular actuation you get a particular amount of it. Like say 200 microgram. This is called rotacap. It's a capsule. ঠিক আছে, rotacap. এর ভেতরে পাউডার আছে। Okay. So the same thing is present there. That is present here, but there is no propellant, only dry powder. And here you have. Here you have rotacap. Acha, this one generically named as actually dry powder inhaler. Okay, rotacap is the product which is produced by Cipla. This is rotacap. It is produced by Cipla. And people say rotacap is the brand name, not their actual name. Okay, it is dry powder inhaler. So he actually dry powder. কিছু কিছু অন্য কোম্পানি অন্য রকম মেকানিজম। এটা যেমন রোটাভেলার, নাও অ্যাজ দ্য নেম সাজেস্ট ইউ হ্যাভ রোটেট। এখানে ঢোকাতে লাগবে ডাক চেম্বার আছে, আমরা দেখিয়ে দেবো যখন তো এখানে ঢুকে এটাকে ঘোরালে এখানে ফিন রয়েছে, এই ফিনের জন্য এটা কেটে দেবে, কেটে গিয়ে পাউডারটা গলায় পড়বে, দেন ইউ হ্যাভ টু টেক ইট। There is a elaborated steps out there. You have to act accordingly. Nebulizer, yes, of course, but individuals cannot do it. Thus, nebulizer is not very practical. You cannot move it. So this one is rescue, super liquid solution, but still it is classified into gaseous form because that liquid with the this লিকুইডটা মিক্স হয়ে যাবে গ্যাসের সাথে এন্ড দেয়ার আফটার আমরা একটু ডিটেইলস আমাদের দেখাবো ঠিক আছে ওকে সো এটা হলে one thing is very important for MCQ purpose so the drug particle we have talked so acha no আরেকটুখানি বাকি আছে so we have drug particles here and that particle diameter actually the deciding factor where these particles will go so if it is less than 1 micrometer means very small so what will happen it will not deposit anywhere it will excel out as it is inspired যেরকম ঢুকেছিল সেরকম বাইরে বেরিয়ে যাবে কোনো এফেক্ট হবে না so 1 to 5 micrometer so this is the diameter we want to get so that it deposit on bronchioles mostly these are used in the COPD patient and asthma chronic obstructive pulmonary disorder and bronchial asthma I think in physiology you have already heard those names so it requires action over the bronchioles the smooth muscle of the bronchioles get dilated by these drugs so 1 to 5 micrometer diameter is the diameter which will deposit the drug into this bronchioles but if it is more than 5 micrometer then what will happen it will not get actually deposit into the bronchioles it will get deposit in the oropharynx okay and if it is deposited on the oropharynx it will not produce any action ঠিক আছে এই জন্য MDI DPI আর নেবুলাইজার এদের ইউজটা জানা খুবই ইম্পর্টেন্ট ঠিক আছে অনেক সময় পেশেন্ট আসে আমরা ডোজ বাড়াতে চাই কিন্তু মাইট বি দে আর নট অ্যাকচুয়ালি ফলোইং দ্য ইনস্ট্রাকশন so that is very important that is why it is there in your at home lastly volatile liquid so halogen is one ether is one so what is happening they under normal circumstances they are liquid but whenever you break the seal you open it in the room temperature they actually evaporate so these are mainly used for anesthesia general anesthesia okay so this is all আপাতত এগুলি এখান থেকে তোমাদের যেটা মেইন দরকার সেটা হচ্ছে যে you have to know the advantage disadvantage of several dosage forms and you have to know about the identification ঠিক আছে okay so what is this no that's not that is not
Sorry,
you take this as tablet which is supplied as solid bottle package okay whatever you are seeing you are just describe so what is this so
the tablet non-transparent packet
okay tablet before you say tablet you have to confirm দেখতে পাচ্ছ না তো আমি একটু পেছনটা পড়ে নিই সো এটা ক্যাপসুলও হতে পারে ঠিক আছে সো দিস ইজ আলু প্যাকেজিং নন ট্রান্সপারেন্ট normal saline so this is infusion infusion টা নিচে করে দেখাই যে আমি এটা অ্যাক্টিং করব okay so infusion and injection দুটোর মধ্যে তফাৎ কি injection means infusion is one kind of an injection but injection international but it is a bulk dosage form মানে you have to use it মানে large dose you can easily give it okay and injection there might be particular time period infusion can go on for hours ঠিক আছে injection কিন্তু এটা কিন্তু খেয়াল রাখো injection কিন্তু can go for hours with the help of pumps ঠিক আছে